And this is our last panel of the day. So we don't want to get between you and happy hour and more networking. Do want to let you know that the happy hour will be moved indoors and staff will share how to get there. But before that, buckle up because we're in for a treat of a panel on government affairs. I think you know our group of experts here, but very quickly, we have Lindsay Austin, who will give us a fantastic what's happening in DC whirlwind presentation. And Zoe Barber from the Sequoia Project, Policy Director Extraordinaire, will be doing a quick regulatory update. And Lindsay Elkind, General Counsel for the Sequoia Project, is also going to be sharing some of the thoughts about privacy and AI and all that good stuff. And so with that, let's go ahead and get started. Lindsay, you want to do your presentation from there?
Yeah, that works.
All right.
Thank you. Oh, we're on. Okay. All right. I don't know if this presentation is going to, I need the clicker.
Oh, I'll do it.
You got it? Okay. I don't know if this presentation is going to make you want to drink more at happy hour reception or less, or should we warn the bartender? I don't know. But yeah, so thank you, Chantal. Appreciate the introduction. And this panel is awesome. Love these girls, these ladies, and doing this together, second year in a row. And so we'll jump right in. Congressional Legislative Affairs, it sounds pretty bland, but it's actually not been very bland. It's been pretty exciting, especially over the last 24 hours, 48 hours, weeks, months. So let's just set the stage right now. I don't want to bury the lead on this week and the activity, but I think we do need to better understand what we're dealing with in Washington. And just as a little background, I worked on Capitol Hill. I've seen a lot of things, been in DC for nearly 20 years. It's just been like nothing I've ever seen before. But here we are. We have a new speaker, Mike Johnson, Republican from Louisiana. A lawyer by trade, only been in Congress for 7 years, which is also pretty unprecedented. But he was elected October 25th after multiple failed nominations that kind of played out over the news and over the course of weeks and months. But after Kevin McCarthy was ousted October 3rd, they needed to get a speaker in place, and they picked the guy that was the number 6 in leadership for Republicans, believe it or not. So he was the vice chair of the conference for the Republicans, but he assented to the speakership, and he's doing the best he can. So I want to offer a snapshot here with his healthcare priorities, what we see as potential healthcare priorities, but then also what is his healthcare experience? I think that's what this audience wants to know. So, he intended at the beginning, and he's also sort of shown throughout his time in Congress, it does have an intent to pass the FY24 Labor, Health, and Human Services spending bill, but with cuts. I think there's some support for the healthcare cost and transparency package, which seems to be pretty bipartisan. The Support Act, hugely bipartisan, needs to be reauthorized, something I think he's intended to want to move. And then PAPA reauthorization, which is the Pandemic All Hazards Preparedness Act, items that we'll discuss a little bit later. But those are on the agenda, but the agenda right now is really consumed with the appropriations process, which we'll get to. And then his healthcare experience. Not a whole lot, other than, he actually led, as he was the Republican Study Committee chair, a push in 2019 to replace the Affordable Care Act with the Republican Study Committee's plan, which isn't that abnormal. That is something that many of the Republican Study Committee chairs have done over the years since Obamacare was passed. But he was also senior counsel at the Alliance for Defending Freedom, an organization behind the Supreme Court case to overturn Roe v. Wade. Setting, again, the tone of where he comes from, but he's speaker now, so that job is a lot different. Okay, here we are, not bearing the lead. We are now here, end of year outlook. 2023 has been quite a ride. This week was a ride too. FY24 appropriations, continuing resolution, that's CR for short here. A laddered CR was passed actually yesterday by the House of Representatives with majority of Democratic votes, as you can see. The Senate is expected to pass this laddered CR probably within the next 24, 48 hours. The White House intends to sign it into law to get us past funding. What is a CR? Well, that's extended funding from the current year's funding. So that's FY23 moving into where we see half of the bills will be funded up to January 19th, 2024. And then the other 8 will be February 2nd, 2024. That February 2nd date includes the defense bill, which is a huge priority for Republicans and already passed in the House side, and it also contains the Labor, Health, and Human Services bill. So you'll see that whole debate happen again. We're not really looking forward to having to go through it all over again, but it does get us past that Christmas crunch, which is really what House Republicans wanted to avoid. Tacked onto this multi-tiered CR was some health extensions, health extenders that were similar to the ones that were passed in October by McCarthy, which ultimately led to his ouster. So you can see some of those just listed that might be of interest to you. So what do we have left? You know, we have the CR, sort of take it off our plate. You know, that was sort of the stress of the day, especially for some of our federal officials that were here this week, not knowing what was on the horizon when they returned to Washington, and the government shuts down on Friday. But we're not going to have to deal with that now. So, and I also need to correct, as of 13 legislative days, it's now 10 legislative days because the House adjourned today, 2 days early, because they were unable to pass their Labor, Health, and Human Services legislation and their Commerce, Justice, Science legislation, the appropriations for FY24. Partially because moderate Republicans didn't like the steep cuts to Labor H, and then the CJS was mostly because of the far-right conservatives still having issues related to the Department of Justice and so on. Typical has happened with a couple of other bills. We'll have to come back to the drawing board, but particularly with Labor H, there's a $14 billion difference between the House version and the Senate version. That is a deep sea to try and swim across and get some middle ground to try and pass a Labor H bill. It's going to be a struggle. It's been a struggle. Labor H is usually one of the hardest bills to pass and sometimes ends up in a CR because of the nature of the bill. But it's even harder right now. So there's only been 7 bills passed by the House and 3 passed by the Senate. They're going to have to reconcile those at some point, and that's going to happen over the course of the next few weeks and months. So that's what we'll be watching. And then there are some other, there's another elephant in the room. We have a national security package that needs to be considered. This might clear up some room with these last 10-ish legislative days on the schedule. So we're going to look at potentially revisiting aid for Israel. Ukraine is a little touch and go. Taiwan and the U.S. border, I think seeing a bill without the U.S. border attached to it is going to be hard to get Republican votes. The White House put up a domestic spending package, which I don't think has much of a chance with all the spending that's happening. But there's other expiring bills that are really important to Congress each year, the National Defense Bill, the FAA reauthorization, and then a PAPA. I include this chart here showing the HHS-related agency totals for the House and Senate just to show you the stark differences. All right, so that was the end of year. You really can't talk about what's in store for 24 unless you talk about what's in store for 23 because 23 is going to carry over into 24, unfortunately. So here, we debated on whether or not to include the shutdown impact slide because we aren't shut down. We have some time. But I think it's important for the audience to know that, what does a shutdown mean? That's the question we get asked all the time is, effectively, how does that affect government? How does it affect me? So I'll give a little bit of an overview and keep it rolling because then we'll have to talk about it again next year. So the shutdown severity really depends on how long a shutdown lasts. If it's a couple days, a couple hours, overnight, over a weekend, it's unlikely to be a full shutdown. If you actually have a couple more days and weeks and months, that's a shutdown, which then will ultimately indicate where you have to furlough employees and pause federal services. So there is a delineation between the two. But typically what we've seen are full shutdowns. We don't like those. They're very costly and very obnoxious. So the agencies do develop their shutdown plans. This is part of their whole deal. The White House, OMB, they have agencies put together their unique plans, but there are 2 sort of categories of what gets funded and what actually carries forward. The mandatory spending for Social Security, Medicaid, Medicare, and then there's discretionary. Those are the programs that get the most affected during a shutdown. And then, of course, a big question is, especially for those of you who work with the agency officials, are they going to be working? Who's going to be accepted employees? That has to get determined by each agency. So if you look to the right here, you got kind of a breakdown of what the agencies, how they're impacted individually. It really isn't that dire, but at the same time it is, because if you affect these sort of services throughout this time period and it lasts a long time, like the one that happened in 2019, you're going to see effects, and it's going to hurt, and it's definitely going to hurt those contractors that work with federal agencies. So HHS could have a little over half of their staff retained. ONC would, without a doubt, be affected. I think Mickey he's still here. Yeah, we've talked about this and knowing that there's a lot of uncertainty, but at the same time, those employees would be furloughed. OIG would be able to continue their oversight. CMS definitely has a lot of the mandatory functions, so they maintain at least half of their staff to manage that. And NIH could postpone clinical trials. That's a concern for a lot of folks. COVID-19 would carry forward, but still, ultimately, not a good idea to shut down the government. It never helps anybody. It never turns out positive for either party. So let's look at what we have in store for health IT and healthcare in general in 2024. I know that feels a long way away, but I think it's important to just rehash what we talked about with FY23. We're going to see it again in FY24 is going to roll over into 2024. And you're going to have the same arguments, except we're in an election year. So things are going to get potentially a little more political. Or you might find some common ground so you can go home and say to your district, to your constituents, look, I did something, even during all of this tumult. So, the House will continue its cuts. They'll have to negotiate with the Senate. It's going to be the same sort of discussions. Hopefully they can tone it down over their break, which I actually believe they needed. They were in session for kind of an unprecedented 11 weeks, which is exhausting. Nobody feels sorry for these members of Congress, but I assure you, when you put them all in a room and they're voting till late at night and battling with each other and not sure which way is up and which way is down, it's really contentious and hard to get stuff done. So the break is probably necessary. So the CR was actually a pretty effective move by the Speaker. Is he going to face repercussions for it? TBD. We'll have another presentation about that when it happens. So also health tech, AI, I want to leave that because I know Lindsay Elkind is going to be talking a little bit more about that, but definitely a focus for Congress and for the White House. Healthcare costs and transparency, mentioned it earlier. There's legislation floating that is moving, still has to be assembled. These really good bills, of course, the ones that you want to see pass are never the ones that actually get considered at the end of the year. It's all these sort of must pass, really loud legislation. But the things that seem to make a lot of sense don't get a lot of attention, not these days. Mental health, a bipartisan area of interest. Telehealth, something that's continued, past the public health emergency, there's a couple of extensions and flexibilities that are going to be considered. Connect for Health Act is one you should watch. That's sort of the main track. Fentanyl and opioids, I think that one tends to be, bipartisan and finding new ways to adapt to the current challenges. That's something across this audience you guys are facing all the time. So I think Congress recognizes that's a big deal for their voters. And again, an election year. Senate Finance package. Senate Finance moves along pretty quietly while, sometimes the Help Committee, I don't know if anybody's watching Bernie these days, I'm sorry, Chairman Sanders, but the Help Committee can get pretty rowdy at times, depending on the topic, depending on who's, witness. But the Finance Committee maintains a pretty low profile but gets a lot done. So keep an eye on the packages that have rolled out there. All right, looking at the administration. I can't necessarily say that they're going to mirror each other, but sometimes they will. Hopefully in 2024, we'll see some mirroring activity, although it may not break headlines. Expanding access to health care. So I think there's an interest in the White House to make permanent expanded ACA premium tax credits. A Medicaid expansion is a huge deal across the country. That's not new news. This is still something that I think the White House wants to get behind, help these states adopt their expansion programs. Coverage of mental health, and then of course rural health access. Equity is always continually a part of the Biden administration's efforts. The AI executive order, huge. Again, we're going to talk about that in a minute. Cancer moonshot, I don't know if you remember, but back when Biden was the vice president, this was one of his #1 priorities, and a part of that was actually health IT. He wanted to find a way to evolve and figure out the best approach and to utilize technology to advance the cancer moonshot. And so he's going to have some initiatives across these agencies, I think, with the cancer moonshot. Drug cost, healthcare cost, obviously a big talking point for both Republicans and Democrats. But the IRA was not supported by Republicans, but there was major legislation in there, major changes to how you negotiate drug prices. It'll last up to 2029. So keep an eye on that. No Surprises Act. Then I'll bring up lastly the cybersecurity efforts from the White House. I know this is of interest to a lot of your organizations. The administration may consider tying cybersecurity requirements to payments for federal health programs. This is kind of a big deal. The administration views cybersecurity as a patient safety issue. This year, HHS released the Healthcare Sector Cybersecurity Framework Implementation Guide to sort of give you a flavor of what they expect from the industry partners across the country. And then, of course, HHS has put out, and CISA has put out a tool tailored for the healthcare sector. So this is obviously going to be an area of interest. Okay, I cannot stop my presentation without at least lightly dipping our toe in the 2024 election. I know, you guys are already exhausted, and you're like, please, now bring on the drinks. We have to talk about it, though, because there's going to be healthcare policy. It may not be the top of the list, but they find their way into almost every debate, as you see. There's a lot of candidates up for this election. You're actually, and I'm dated here because Tim Scott has now fallen off and endorsed Nikki Haley, but we have Jill Stein added to the list. And so you're seeing sort of this, juxtaposition and change of who's going to be in, who's going to be out, whether debates matter or not. They're still going to be all talking about abortion, public health trust, COVID-19 response. How do we prevent the next pandemic? I think those are very big national topics they have to talk about and find their positions with the electorate. Medicaid expansion, again, there's some governors in here, they dealt with it firsthand. ACA and how that's going to be managed, whether on this side of it or this side of it, it's going to be talked about. Healthcare spending, transparency, and then of course Medicare and Social Security. One of the longest historical topics of any presidential debate is how to find the sustainable programs there and how to make sure that you tell your seniors and those folks that are utilizing those programs, you're not going to take them away from them, but you're going to cut them. So that's the challenge that these candidates have. So, I'm not going to go too deep into it, so we'll leave it as a teaser. But yeah, there's some polling out there. Just ignore it for now. Just take a deep breath. We don't need to worry about it until maybe the end of quarter one. We'll start to know a little bit more. But I do think you should pay attention to what's happening in the House and the Senate. You have let's go back to the beginning. We were setting the stage. We should have said at the top, the House slim margins and the Senate slim margins are 99% of the reason the tumult of Congress has occurred over the last. I mean, it is some drama and personality, issues, but the fact that there's such a slim margin and a speaker cannot rally his troops to pass legislation and coordinate with the bicameral coordination is because of these slim margins. And so same thing in the Senate, just a little less raucous. But there are 34 seats up next year, and Democrats are probably going to be struggling to keep a lot of those, especially with Manchin announcing that he won't be running again. But who knows what he's going to do? He might be on this list next time. So keep an eye on that and see how it plays out. That really does matter on how health policy moves. And you're lucky that a lot of the issues you guys face are not the political hot potatoes, but they can be. And I think that's why we're going to be talking about privacy and AI a little bit, because I think people want to talk about that a lot across the country. So with that, I'll hand it back to Chantal. Zoe?
Yeah, great. I'm just going to make a little observation, which is keying off of what you just said. We often think of health IT as a bipartisan issue, and it's really supported. And I think that's testament here at the Sequoia Project to that focus on implementation and doing things on the ground. Interoperability for the public good. I do love that tagline. So, I think that really serves this community well. But let's move on, Zoe, to a little bit of the regulatory update. Maybe not quite as many characters in this, but lots of really important rules being written.
Yeah, thanks, Chantal. Yeah, it's not necessarily as exciting as Lindsay's stuff, but we do have our fun. I gotta say, I can't read a thing on this slide right now, so I'm gonna wing it, and people can shout out in the audience if I miss anything. This is regulatory initiatives from this year and going a little bit into next year. I just wanted to kind of repeat something that Mickey said earlier this morning, if you caught his remarks. It's really very clear that the Department of Health and Human Services is taking a deliberate approach to pushing forward these consistent, coordinated regulations that really are working together in harmony to advance the department-wide goals of interoperability, FHIR-based exchange, standard-based exchange. And so we're really seeing that coming to fruition as these rules are working together. So starting off with the Office of No Christmas is at it again. Lots of irons in the fire at the end of the year here. So first up, we have the HTI-1 final rule is in OMB review. Last I checked, it's still there. We're anxiously awaiting that. The Sequoia Project and Care Equality submitted comments on that rule earlier, the proposed rule earlier in March when it came out, particularly on the TEFCA condition in the manner exception, that attempts to make it easier for information blocking actors to utilize TEFCA and leverage TEFCA to meet their compliance obligations. We also heard that we can expect HTI-2 hopefully before the end of the year, at least the proposed rule, and looking forward to some exciting tidbits on public health in there. We know that ONC and CDC have really been working together in lockstep in advancing public health. And then, of course, you've heard all today about TEFCA. We're really excited about our candidate Q-HINs, or our TBQs, as we call them, who are getting ready to launch and go live at the end of the year. Also, there may be some additional SOPs that come out before the end of the year, also in accordance with version 1.1. So that should be exciting. And then skipping ahead here, ONC was primary drafter on a department-wide policy for the provider disincentives for the information blocking rule. So that came out earlier in October. Comments are due on January 2nd. The Sequoia project is already actively looking through and thinking about comments. Notably, this rule really focuses on disincentives for providers that are regulated under the Medicare program, so those that are participating in the Medicare Promoting Interoperability programs, as well as the ACO shared savings programs. So there are some pretty strict proposed disincentives in this rule that could ultimately end up in penalties or holding back incentives of up to hundreds of thousands of dollars in some cases for eligible hospitals and eligible clinicians, as well as potential suspension from some of these Medicare reimbursement programs. So those are some pretty significant penalties. And CMS also has a few other things going on right now too. There is the interoperability and prior authorization final rule, which is also in OMB right now, in OMB review. The draft came out last year. We also commented on that. That contains all of those beautiful payer APIs that we're excited that will hopefully enable the payer use case and allow payers to share claims data across providers to other providers, payers, and consumers. And then, of course, CMS passed their annual payment rules on time this year, including the 2024 physician fee schedule rule that came out a few weeks ago. Earlier this year, in July, we saw the long-awaited Office of the Inspector General regulation final rule published on information blocking enforcement for health IT developers of certified health IT and health information networks. So investigations officially began on those actors on September 1st. And notably, OIG mentioned that they will not be investigating providers until that final provider disincentive rule actually goes into effect. And I also forgot, I wanted to mention, with the provider disincentive rule that, while this draft is focusing primarily on those, Medicare regulated providers, of course, we all know the definition of provider in information blocking is much broader. And so this rule is really setting a regulatory framework that could, continue to build and, potentially apply additional disincentives for those providers that don't participate in those programs later on. And then, of course, not last but not least, the HHS Office for Civil Rights. Earlier this year, we saw a proposed rule on modifications to the HIPAA privacy rule to strengthen reproductive health. Privacy, again, the Sequoia project, in collaboration with our interoperability matters work groups, submitted comments related to that, mostly in support of the proposals to apply, prohibitions to sort of the purpose of use exchange purpose for reproductive health, as opposed to applying kind of blanket prohibitions on the exchange of reproductive health data. And then there is a proposed rule that's in the unified agenda expected for Q1 of 2024 that is attempting to, propose a methodology to distribute civil monetary penalties to those that may have been impacted or harmed by HIPAA violations. And they're also proposing to incorporate recognized security practices into their evaluations of, potential penalties for violations. Last year, OCR put out an RFI on how they might apply these recognized security practices more broadly to their enforcement. Again, the Sequoia Project also commented on that, so we're looking forward to seeing how that may come out in this updated rule in the new year. And then finally, and it's not here, we're still waiting for a final rule updating with updates for HIPAA privacy related to case management, care coordination, fees, and several others. So we're looking forward to that. Lots going on in the new year. And if any of you are interested in hearing more about these rules or helping us to draft comments on these, then I can guarantee you that there is an interoperability matters work group for that between payer-to-payer work group, our privacy and consent work group, information sharing, and government affairs. We cover all of these rules and more.
Great, thanks, Zoe. And speaking of the information sharing work group, I want to give a quick update. That was such a great plug. Thank you, Zoe. Just a quick note that the information sharing work group used to be the information blocking work group, but you recall that the annual meeting last year, we really unveiled this concept that it's about the culture of information sharing. And the information sharing work group is actually the very first Interoperability Matters work group, and it's been going on for a number of years. I want to take this opportunity to recognize our co-chairs for that group, Dr. Matt Eisenberg from Stanford, Josh Mass from Oracle Cerner, and Ammon Fillmore, who is at Advent Health and unfortunately couldn't be with us at this meeting. This group has really been so active in helping build out good practice for folks, and over this past year, really looking closely at the various regulations that have been coming out, not only helping to shape Sequoia comments, but also to provide perspectives to the community. So in addition to being part of the work group meetings, sharing perspectives across actor communities, which is very unique in this work group. So we have the developers, the providers, people who are looking for the data, as well as the HIE perspective. Not only are they sharing perspectives, doing the dive on the regulations, but then we had some volunteers this past year to write a couple articles. So if you want to learn more about what the work group discussions were, two LinkedIn articles that will be on the Sequoia Project page that really dive into both the OCR rule on HIPAA privacy and reproductive health data, which is tied to some of what was in the ONC HTI 1 rule on questions about how do we segment data for privacy, what are the kinds of tools that we could help build to address this key question of what if there's something that shouldn't be shared. We don't want to not share anything because of that, but how do we address that question? And then there's another article there on thinking about the information blocking rules themselves. So ONC came forward with refinements to the information blocking rules, many of which actually do correspond to ideas that the Sequoia Projects and others brought forward to say, how can we make this more workable? Because we do want to share the data. We're not looking to bring information blocking to a halt. We're looking to find ways to make it possible, right, to share the data safely and in accordance with all of the privacy rules that are out there. So the group will be meeting on Friday of this week. So those of you who are part of the information sharing work group, please come. Friday breakfast meeting, we'll be actually digging in to the provider disincentives rule. So that's my little plug for the information sharing work group. And at this point, I'm going to hand it off to Lindsay, speaking of privacy.
Just click it over one
Oh,
side.
okay, I'll do it for you.
I'll just break that. I think you got this.
So this all comes together in artificial intelligence. Tell us how, Lindsay.
Yeah, there's really nothing to talk about here, right? Should we just go get drinks? What do you think?
You should get AI to do it for you.
Yes, we should type the prompt into ChatGPT. You weren't kidding when you said this was really tiny. Oh, goodness. So yes, I think the big highlight of all of this is the highly anticipated executive order that the Biden administration put out in October 30th. Would have been fun if it was Halloween, but, you know. And then close on its heels, the Office of Management and Budget also released a directive. And both of these really covered just about over 20 federal agencies, each with varying implementation timeframes, spanning from 45 days all the way to a year, and asking for the agencies to do various things. The executive order, speaking of the OMB, the executive order specifically directed the OMB to conduct assessments on personal information collected by agencies and third parties that they may utilize and assess. And also just a key highlight, both the directive and the executive order apply to federal agencies, so federal government here. They're not talking about industry at large, but of course, you know, seeing federal policy and the executive order, it's definitely going to impact how regulation shakes out and how industry handles these types of things. So focusing on healthcare and HHS, you know, the executive order did direct several things specifically to HHS with respect to healthcare information. Again, it's a long, broad-spanning executive order that covers a variety of different areas. So few key highlights for HHS, you know, really the big thing was to create an AI task force that really focuses on strategic plan for the responsible use of AI and thinking about comments, you know, that Mickey had said earlier about transparency and responsible use, and I think a lot of this is going to focus there too. So also publishing plans on use of automated or algorithmic systems and implementation by states and localities for public benefits and services, and also focusing on provider compliance with non-discrimination laws. That was a key point that was addressed for HHS as well. So for the OMB directive, HHS particular has until August of next year to implement minimal guardrails for certain types of AI that are going to impact, you know, safety or rights. So again, sort of entering that non-discrimination realm. And these safeguards include a whole host of things: AI impact assessments, independent evaluations, testing AI in the real-world context, identifying mitigating factors contributing to algorithmic discrimination and disparate impacts, and it goes on. So it does get pretty specific with what they want HHS to focus on. Oh goodness, this really is very small. So the national, and a few other things just on the administrative side of things, the National AI Research and Resource, or NARE, which it looks like they released a report in January requesting $2.6 billion from Congress over 6 years. And oh my gosh, I cannot read that. Lindsay, can you read it?
Yeah, the funding is requesting R&D research, and it's not guaranteed, but that's what the goal is to try and get some dollars committed to some AI R&D, and this is for technology, you know, triple P, agency work, but it's not set in stone. So. Yeah.
Also, there's OSTP put out an RFI back in June on national priorities for AI. So a lot going on the administrative side of things.
Yep.
And on the congressional side of things, I think as Lindsay mentioned, you know, there's a large Senate AI work group. Senators Schumer, Young, Heinrich, and Rounds are all leads on that. They've held summits and discussions galore on Capitol Hill over the fall. And Schumer also rolled out AI policy framework in June as we think will be a launch pad for some comprehensive, maybe to come bipartisan legislation and possibly some legislation in 2024. So again, a lot of other hearings too.
In late breaking, in November 9th, they hosted one of these insight forums on privacy and liability, and we can talk a little bit more about that during Q&A. But they're moving along, and this is a peak interest to especially Leader Schumer. So
Yeah.
go ahead, Lindsay.
And also, there's been a few other RFIs. The Senate Health Committee and Bill Cassidy in particular, released a white paper on the political benefits of AI, including healthcare, back in September. And the Health Committee also released an RFI for stakeholder feedback for some privacy-specific asks, and the Sequoia Project did submit some comments as part of that. So there's just a lot going on, both on the administrative side and the congressional side.
Yeah. Eager to address the issue on both sides, and hopefully in a bipartisan way. But yeah, I think we're ready to maybe break it down.
So we've got about 3 minutes for a little bit of panel conversation, and then we're going to have 7 minutes for Q&A from the audience. So think about your questions, and then we're all going to retire to the happy hour. But really, as we think about AI, as we think about information sharing, privacy always is raised as yes, but. So Lindsay, Elkind, when you think about privacy and consent, what are 1 or 2 of the top trends that you're thinking could be coming down the pike?
Oh gosh, privacy and consent is a focus for literally everyone in healthcare right now. All of the sectors, we got consumer, we got security, really everybody's just focused on this. And I guess when we think about trends, 2 obvious ones come to mind. Thinking about the myriad and the complexity of revolving door of state laws and frameworks that we're seeing come out. And frankly, it's something I think as a community, we're still grappling with. I'm trying to think, I think about it as like the new telehealth in my head. When we saw like tons and tons of telehealth legislation come out, we're now seeing tons and tons of state laws come out, around consent requirements, and those can vary based on the state. Also around certain aspects of sensitive data, reproductive health data. And this isn't just about, healthcare data. A lot of times they're addressing the larger bucket of consumer data as well. So you just have a web of state laws and trying to grapple with how those overlap and what that means. Is really just one of the trends I think we're continuing to talk about and see, and we'll continue to talk about in many months and years to come. Of course, I think with privacy and consent in particular, it's hard to talk about that without talking about the Dobbs case too. And I really think that the Dobbs case in particular, really focuses the issue and really brings it to a head if we're talking about really sensitive reproductive health data and patient privacy, while we're also talking about information sharing. So it's really figuring out how these balance and how these work together. And I think those are trends, we're going to continue to see. And I think this is a really critical discussion. And again, not to make a shameless plug here, but to make a shameless plug. We have a brand new work group addressing privacy and consent, chaired by Stephen Lane and Devin McGraw, that I really think is going to be fantastic. We're going to talk about some of these really difficult, thorny issues and hopefully get in the weeds on some of this. And also realizing that there's a lot more to this discussion beyond privacy and consent. There's AI, like we just talked about, data segmentation for privacy. There's thinking about how do we apply these types of frameworks and rules to entities that are not regulated by HIPAA. What does that look like? So I think there's a whole host of things to discuss. And Chantal is actually moderating a panel tomorrow, so I don't want to spoil it too much, but they're going to talk about some of those issues as well.
Absolutely. And so I just want to connect the dots back to TEFCA a little bit. So how is it that TEFCA will help folks align privacy?
Yeah, it's a great question, and probably one of the questions that the RCE receives the most, I would say. So TEFCA and the Common Agreement are created to exist within kind of the confines and the structure of existing regulatory frameworks and laws. And the common agreement itself, sets, as you all heard earlier on the TEFCA panel, sets sort of baseline, privacy and security rules for everybody that participates. So, including the sort of broad requirement to abide by the HIPAA privacy and security rules, from a contractual standpoint, even for those entities that are participating and are not regulated by HIPAA. But at the same time, yes, there's that baseline, but the common agreement also has the expectation that everybody that's participating, down to the furthest sub-participant and user all the way down the chain, that they are complying with applicable law, and in particular that they know the laws that apply to them and that they are able to that they are able to apply that and make a determination of compliance, before they respond to a query or send a request for data, within TEFCA. The RCE and ONC, we can't police that. We can't govern that on an everyday basis. We are able to do some things at sort of that top level, and we have a governing council, and we're going to have, the QHINs that we're able to sort of set some of those broad level privacy policies. But at the end of the day, it's really going to be up to those participants to determine, what laws they have to comply with, and for the QHINs to help their members and their participants to understand what rules apply to them and make sure that they're complying with all of those obligations. So we're really relying on it's going to be a group effort. And of course TEFCA, although it can do a lot to help and to streamline, it's not a silver bullet for privacy, or for anything else for that matter, but certainly it's not going to be a silver bullet that solves all of the variations and the complexities in privacy laws across the United States, but it can be another tool, another mechanism to attempt to kind of bring all of these diverse types of entities that are governed by different laws sort of under the same umbrella of kind of the high level, national privacy expectations.
That's great. And if folks want to kind of think about Q&A and raise their hands, we'll get mics to you. And as that's happening, you get 30 seconds. What are the odds we'll have a national privacy law to help us solve this?
Well, I think AI, the fact that we're spotlighting it, could be the straw that breaks the camel's back when it comes to addressing privacy and a national standard. I mean, this is finally getting the attention it needs. Last year when we did this presentation, we spent a lot of time on looking at the ADPPA, and we were making some progress, but then Pelosi, pulled it back because of the California needs, and Cantwell started to make some hedge towards trying to move, and then it really just kind of left the scene. And it hasn't really been brought up to date. There's been a couple of privacy bills reintroduced that might have a little bit more attention. But I think really what's in store for 2024, if they're still talking about AI, it's a chicken and the egg scenario. You can't have one without the other. And that panel that I just mentioned, the Insight Forum that they hosted around privacy and liability, all those panelists, guess what they said? We need a national privacy standard. How are you going to handle that? How are you going to do that? Because that's the only way we can address AI. This is not this. I don't think government wants it to be a government top-down approach. They actually want stakeholder input. There are some members of Congress out there who said they want states to address AI, but you can see that that's not going that great with privacy. So we're going to allow people to come to the table, have their thoughts and ideas about it. But I really think that it's going to be a dialogue that can prompt together. They go hand in hand.
Great. And I think I see a question over there. Go ahead, Matt.
Question over here. Matt Eisenberg, Stanford Healthcare. So I have 2 comments. I have 19 questions, but only asked 2. And the 2 are of increasing complexity. First, I just want to comment. None of us need tea leaves. You guys do an incredible job up there. Very, very, very helpful, and I always appreciate it. Second is the information sharing work group would not nearly be as successful, Chantal, without your effort and leadership, and I just want to recognize you.
Appreciate that. Now he's going to ask a zinger question that we can't answer.
That's right. So the first question's pretty easy. Like, who came up? So I liked TLAs like everybody else, three-letter acronyms, but HTI, couldn't we have done like
HTI
data,
one,
interoperability, technology, and you, like it'd be Diddy 1, Diddy 2, Diddy 3. Who came up with that one? Mickey, is that you?
It's better than 2015 Cures edition coming out in
yeah.
2018, 2019, 2020.
The album drops.
Okay, well, we'll work on that. So the real question I have for you is really about data segmentation. As we're waiting for stuff to come from OCR, we've been talking about this. So Maryland's passed a law requiring data segmentation. California just passed AB 352, data segmentation for abortion, reproductive health, gender affirmative care, and contraception. We don't have the technology to do it. The regulations are going to come state by state by state. We're going to get hammered. How do we deal with that?
I think that's a really great question. It is part of why we're bringing together the privacy and consent work group. And really the goal from my perspective, at least, I don't want to speak for the Sequoia Project Board, but is to make information sharing possible even within that environment. We really need to do everything we can to prevent the solution being, I can't share. So I don't think anyone has the solution, and Dr. Lane and folks will talk about this tomorrow, but how do we bring the community together to create at least some real world tools to prevent the solution being we can't do this. And then on the policy side, really continuing to bring that message forward that, you know, we really do need a national privacy solution. Whether it's a national privacy law or not, I think we can leave that aside, but we really do need a solution that governs the data and not the actor or the location, right? Because data is not geographically bound. Anybody else want to speak to that?
No, it's
That's already in.
All
we'll
right,
have
we
hours.
have
I'll go.
2
Literally hours
minutes
to
and
talk.
20
Sorry.
seconds left. Who's next?
I'm Michael Seidel from Epic. My question is really building off of Dr. Eisenberg's question, and I'm wondering whether the Sequoia Project is engaging with state governments or whether there's resources available to them, pathways for them to get plugged into the work that you all are doing, because you know, we're starting to see, as Dr. Eisenberg mentioned, like in California, for instance, they have their own version of CalTEFCA, and wouldn't it be great if, you know, we didn't have to go state by state implementing TEFCA and could do it at the federal level. So I'm wondering, you know, are you engaging with state governments? What resources are there available to them to learn more about what's going on at the federal level and how they can work productively with those federal efforts instead of, you know, reinventing the wheel?
Yeah, and I'll say something, Lindsay, and then maybe you can follow up. So there is technical guidance that is shared from the national networks to states as they're thinking about these things. So both eHealth Exchange and Carequality did share through other parties, mostly Sequoia Project members, what they were doing and how these national frameworks work so that the state of California could be informed of that. But sharing that experience through its members for them to help educate their own states is really where that effort took place. I think it's fair to say that the Sequoia Project is focused at the national level, and we do sort of work there. And Lindsay, I don't know if you want to add anything else
No,
to that.
I don't really have anything to add, just the last point about Sequoia really focusing on the national level. But to the extent you have ideas or you want to come to the work group and help us hash through some of these things, I think, you know, there could be a real opportunity to help connect both the national and the various state levels.
Yeah.
So really look forward to further talking about it.
Yeah, and I'll just add that, while we may not necessarily have, really formal initiatives underway working with, individual state agencies, that we're sort of always informally, keeping up to date, meeting with people, networking, coordinating, and in particular, the California framework. That's something that we've, the RC in particular has been, having ongoing discussions with the folks in California to make sure that, we are in alignment and to share best practices. So we're keeping up to date with all of that. And then I'll also add that we've been having, I know we're over time, but we've been having a lot of conversations related to public health recently, in terms of we've been working on developing the public health use case and sort of more narrowly defining public health use cases under TEFCA. And so through that effort, we've been kind of doing an outreach campaign to several public health agencies across the country.
I don't know if you guys can see this. It's like an aggressive flashing red. We don't want to
It's doomsday up here.
And for our next session, I promise I will bring glasses or bifocals
okay.
or a binocular
That's okay.
or something.
Got a lot of text on there.
All right, well, thank you for the panel. Marianne.